the mammograms again, use radiation, and that's going to cause more problems. So women who are young absolutely should not get mammograms unless there's a really good reason to do it. So the guidelines had been for everyone else, the average woman, to start at the age of 40 and do it every year after that point. Now, last November, new guidelines were released by the U.S. Preventive Health Task Force, which looked at all the research, and it was very good research. They were actually commissioned by Health and Human Services to investigate and come up with guidelines. And this is what this commission does, is they look at all different sorts of diseases. They did the same thing for prostate cancer in men, look at the research and decide what are reasonable guidelines based on the risk of testing, based on overdiagnosis, overtreatment, underdiagnosis. So they look at all the different factors. This commission determined that the best age for a woman to start screening for breast cancer with a mammogram is age 50. Not age 40, but age 50, and every other year after 50. Now, part of that is because there's a risk of the mammogram from the radiation, and also women under the age of 50 tend to have denser breast tissue, which makes reading a mammogram more challenging and leads to higher false positives. So more women were being told they have breast cancer, and then they get a biopsy, and they find out, well, there's nothing there, come back in a year and we'll do another mammogram. Instead, women who are under the age of 50 should really be doing a breast thermogram and get information about blood flow. It doesn't put you at higher risk. If we find something, well, then we may do a mammogram, but then we're going to do a diagnostic mammogram because we found something abnormal on the thermogram.
So how often would someone coming to you, how often would you suggest they come and get themselves checked out?
I always do a 6-month follow-up to a baseline. So if you were to come in today and everything looked okay, I would do a follow-up with the thermography, with the breast imaging in 6 months. And I do that because I want to verify that what we've seen today on the baseline is stable. Because the changes in blood flow can happen very suddenly. They can happen in a matter of a few months. So I recheck at 6 months, make sure everything is still identical to what it was at the baseline. And if everything looks great at that point, then I normally do yearly screening at that point.
Okay. Okay, makes sense, makes sense. Now, my next question to you was regarding the breast cancer. Do you actually have to call and make an appointment, or can you just walk in?
At my clinic?
Yes.
Make an appointment.
You have to make
because I unlike many doctors, I spend a lot of time with people. Because I'm trying to educate them, and I'm trying to figure out, I'm doing detective work to find out what's really wrong with you. I'm not putting people on medications
so you can't
normally.
Just walk in,
yeah, so it's not like, well, I'm having this GI pain, well, here, take this pill, and I get them out of the office. It's like I do investigative work. Normally when somebody has an initial appointment, I sit down with them for about an hour, and I find out, okay, all what's wrong with you, everything from their headaches to their asthma to their GI problems, if they're having stomach problems, everything, and then I do any lab work that's appropriate. If they haven't had any in a while, I may do blood work or some other testing. I do any physical examination, and then I do a follow-up where, having all this information, I sit down and I have a plan of action. I say, this is what I'm thinking is wrong, and go into the details about why it may be happening, and then exactly how to treat it. And when I treat something, I use everything and anything at the same time that makes any sense.
Okay, so now, do you agree that a natural, and meaning saying natural, medicines, so many people believe in, I have this going on and I need to start taking some type of medication. Well, I don't believe in medicine. I believe in natural things, plants and natural eating and all that good stuff. But a lot of people immediately think, let me take this medication, not realizing that medication causes other problems. Now, is this something that you also tell to your patients? That
they should use more of a natural medicine?
Yes.
Well, absolutely. Exactly. A classic example of that would be diabetes, or even say pre-diabetes. And when I say diabetes, I mean like type 2 diabetes that people tend to get when they're older and later in life, and also from obesity. So if somebody's getting heavier in their 30s and 40s, they can start having blood sugar problems. And then usually what will happen is a doctor will at some point put them on metformin, which starts helping with the blood sugar. Then they'll end up on a second medication, a third, and eventually they'll end up on insulin. Okay, that's the normal course of diabetes as an adult. What I do is I intervene early. If I see them and I start seeing their blood sugar start to go up, or they're already diabetic, I sit down, I call it my come to Jesus talk, Because I have sometimes I have individuals come in who think they're fine, they feel okay, I do blood work, and I'm like, you're diabetic. Fortunately, it's early, it's just starting. I change their diet, their blood sugar comes down, and they're fine, and I keep them off medication. And usually also help them lose weight, because usually they have a little bit of a weight issue. But for an early diabetic, if you make dietary changes and you lose body weight, and it doesn't mean a lot of body weight, your blood sugar will almost always come down, and you can either not go on medication, or you can often get off of medications that you're already on. And the significance of that is, no matter how much medication you're on, and no matter how well you're trying to monitor your diabetes with medication, you will never regulate blood sugar with medication as well as what your normal functioning healthy body will regulate blood sugar.
That's what I wanted to hear, Dr. Nick.
Absolutely.
Makes a lot of sense. Well, I want to thank you for coming on and giving us all of this information about breast cancer, how to prevent it. And you all need to get to the doctors and get yourself checked out, especially Dr. Nick. He seems like he's a really easy doctor to go in, and you don't have to worry about getting smashed.
Yes.
But I wonder, how do they do a man's mammogram?